Good morning, everyone, and welcome to the evaluation session of the Public Health Community Institute. We'll start with some brief introductions. My name is Louisa Pessoa-Rendell. I'm Director of Public Health Initiatives with the Minneapolis Health Department, and I'll pass it on to my colleague, Marissa.
Hi everyone, my name is Marissa Hogan. I'm a senior public health researcher and epidemiologist with the Minneapolis Health Department. And then I will be starting us off with today's training and then passing it back over to Louisa to do the later half of the training. But we'll start by going over the agenda for today. And we just did some quick introductions of the trainers. Next, we'll go over some learning objectives for the training. Then we'll go into the definition of evaluation, talk about why evaluation is important, and talk about the different types of evaluation. And then we'll go through our evaluation framework. So our learning objectives for this training, write and implement SMARTY goals and objectives, conduct a program evaluation from start to finish, and use evaluation as a tool to improve your program. So with the definition of evaluation, technically, evaluation is defined as a systematic process to determine merit, worth, value, or significance. In other words, evaluation helps you see whether your program, policy, product, or whatever you're setting out to evaluate has achieved what you expected. And there are many types of evaluation, and on this slide, we just have a few different types listed. So for example, you could be evaluating a product, a policy, personnel, or a program. And with this training, we're going to be focusing on program evaluation. So why is program evaluation important? There are a few different reasons. And first, you've probably seen this image a few different times in previous trainings. So program evaluation is part of the public health approach. You can see it here above that third box. So it starts off with this public health approach with surveillance, figuring out what the problem is. From there, we identify like the risk factor, what's the cause of the problem. And then this third step is what works. So that's where we are evaluating the intervention, trying to figure out, what works within our program, policy, whatever it may be, to help, with the problem that we've identified. So that's where evaluation comes in. If we go to the next slide. And then program evaluation is also one of the 10 essential functions of public health. You've probably seen this wheel before with the 10 essential functions around the wheel with equity centered in the middle. And program evaluation allows you to determine how effective and efficient your program policy organization is in reaching your outcomes that you've set. And it's also crucial in informing your decisions, acting on your findings, and driving continuous program improvement. So this slide's a little overwhelming, but there's a few different types of program evaluation specifically. So there's formative program evaluation, process or implementation evaluation, outcome evaluation, impact evaluation, and economic evaluation. And a lot of times when you're applying for different grants or other funding sources, you're going to see process and outcome evaluation mentioned, or having them want you to talk about how you're going to be implementing process and outcome evaluation within your program when you're writing out your grant proposals. So process evaluation is assessing how well the program implementation followed the original plan. So you laid out, in your grant proposal, I'm going to do these activities, which hopefully are going to lead to these outcomes, which are going to help us reach our overall goal that we applied for. So the process is saying, we said we were going to do these activities. Did we do these activities? Yes or no? Did we do them in the way that we intended to do them? That's kind of understanding process and evaluating that. And then outcome evaluation measures how well a program policy or organization has achieved its intended outcomes. So this is kind of understanding, okay, we said we were going to do these activities, we implemented them. Did implementing these activities help us reach that outcome or overall goal that we set? And one thing to note with outcome evaluation is it cannot determine what caused the specific outcomes, only whether or not the outcome was achieved. If we're kind of looking to get more at like understanding outcomes, that's when impact evaluation can come in. But like I said, process and outcome evaluation are very common and something that you're probably going to see if you're applying for grant funding and other opportunities in the future. And then some key points for program evaluation, and these are kind of our take-home messages for you all with this training, is that program evaluation should start at the beginning of your program. It should start with program planning, and it should be an ongoing component of your program. It's not something that should be, like an afterthought, something that should be like, oh, we're at the very end, like now let's try to evaluate and submit this information to our funders. It should be something that, you plan on when you're starting your program, and you should be doing it throughout your program. And evaluation should be fun. It doesn't have to only be, surveys to collect data. We'll talk about that in the next slide. There's other informations or other ways to collect information and evaluation data that isn't just surveys. And also it shouldn't be seen as just a requirement to report to funders, but it should be seen as a tool for you to improve your program and to continuously improve your program and to show, the great work that you're doing and to tell the story of your program. So don't think of it as just, another thing that you have to do to report to your funders, another requirement, but to showcase the great work that you're doing and to tell your story. So as I mentioned, there's several ways to collect evaluation data. It doesn't have to just be surveys. A lot of times you'll hear about like quantitative data versus qualitative data. So quantitative data, when we think about that, it's the numerical data. So it's, counts, percents, rates, those numbers. And when we're collecting quantitative data, there's several ways to do that. And there's even more ways to collect quantitative data than what I have listed on this slide. But several common ways are, collecting surveys or doing surveys, tracking forms. So like you thinking like sign-in sheets, counting the number of people who signed in to sign up for the training, counting the number of people who signed up, to receive a certain like benefit, something like that, document reviews. And then on the other hand, when we're thinking about qualitative data, that's that non-numerical data. So text, audio, video, and there's several ways that we can collect this information as well. Thinking about like open-ended questions, and those can be on, surveys, during focus groups, interviews, when people are kind of talking and telling their story, doing storytelling, concept maps, video, art, all different ways. And a lot of times when you think about qualitative data, it's adding more information to the numbers. Numbers are great, and a lot of times you'll see funders wanting numbers to be reported to them, but the qualitative data gives us that the stories behind the numbers and makes your evaluation and your story that more powerful and impactful. So it's nice to have both when you're kind of wanting to tell your story. And then I'll just go ahead and introduce this framework, and then Louisa will go ahead and kind of get into each of the steps a little bit more. But the framework that we're going to introduce was developed by the Epidemiology Research and Evaluation team, or the ERE team at the Minneapolis Health Department. And it was developed to identify and define critical steps in project planning and evaluation, because again, project planning and evaluation go hand in hand and should be done together and continuously throughout your project. And it's meant to be consistently replicated and adapted to meet a variety of program evaluation needs. Because we know that no two programs are the same. So this way it can be used for a variety of different programs. And there's a few different steps within the framework. The first is context setting, and then there's planning, executing, analyzing, disseminating, and then using, learning, and adapting. And you'll see that this framework is purposely put into a circle because once you finish going through the loop the first time, you'll kind of go right back in and start again with that first step once you complete the last one. So I'll go ahead now and turn it over to Louisa to kind of get a little more in depth into each of the steps of the framework.
Thank you, Marissa. And as Marissa said, this is a framework that goes hand in hand with your program planning. And if you have you attended or listened to the program planning session for PHCI, you saw that Becky presented a program development framework that has also 5 or 6 steps and goes hand in hand with this framework. So as Marissa mentioned, our step 1 is context setting. And the reason we do that is we need to understand what is the project, and how does the evaluation fit in? What is that process? What are the team roles? And as a result of that context setting will also help you identify who your target population is, what is the scope of the evaluation. And so at the end of that step, you should be able to say whether the program is ready for an evaluation or not. You have some situational awareness of what the context of the program. You have identified or defined who some of the decision makers and stakeholders are that will need to be engaged with the evaluation, and identify what are possible resources and obstacles that may need to be overcome. And that leads you to your step 2, which is planning. And in that step, you're going to try to determine the project and evaluation questions. What is it that you're trying to evaluate? And you always want to be sure you're centering equity in the design of the evaluation plan. Some of the decisions that you're going to make related to during this step is they'll be making decisions and developing documentation around project management, how you're going to collect and manage your data, how you're going to engage those stakeholders so that there's buy-in from them into the evaluation, how you're going to analyze the data that you collect for your evaluation, and how are you going to disseminate results. And that's really important, to be thinking ahead, even prior to collecting data, to be thinking about how are you going to disseminate and inform people of the results, because that is the whole purpose of evaluation and collecting data. You don't collect data if you're not going to be sharing it with people. So in planning, you're going to talk about how is the evaluation going to be conducted, by who, and when. You're going to talk about determining evaluation questions and indicators, making project decisions, management decisions, and developing the plans for that implementation. As we talk about developing evaluation questions and indicators, if you think back to our learning objectives, we talked about developing SMARTY goals and objectives. And what are SMARTY goals and objectives? It is a way, SMARTY is a definition of a goal or an objective that is just a fun acronym to talk about things that you want to be sure you're thinking about when you're developing your objectives or your goals. You want to make sure that it is specific. That is, does it actually state an outcome that you're trying to accomplish? And where, what is that? Is it in a particular population? Is it a particular geographic region? It's not something like everybody will be happy. That is not a very specific objective. Is it measurable? Can you measure? Is there a way that you can measure that objective? Is there an indicator that you can develop that will help you measure that progress? Is it attainable? If you say something like, everybody's going to quit smoking within 3 months, that might, all program participants will quit smoking within 3 months. It's specific, it's the program participants, it's measurable, quit smoking, but is it attainable? Can you really guarantee, make people quit smoking within 3 months? We know that behavior change is hard. So thinking about something that's realistic, that you would be able to attain within that timeline. Is it relevant? Maybe you're doing a project that is about eating healthy, but you're talking about quitting smoking as your outcome. Maybe those don't go together. So is the objective aligned with the priorities of your program? Is it time-based? So do you have a deadline, saying something like within 3 months, within 6 months, within the first week? In a process evaluation, for example, you will have those objectives. Well, you'll say in the first 3 months of the program, we will host 3 meetings or something like that. So are there time points that during which you'll review progress to, so that you're seeing that you're making progress in your objectives? And then it used to be SMART goals and objectives, and we've added the I and the E. So I for inclusivity and E for equitable. We want to make sure that we are considering input from those that you are implementing the program with, the populations of focus, so that there is buy-in and so that you are actually trying to achieve objectives that are applicable to that community. Coming in and telling someone what their objectives should be or what they're looking for is never a way to be successful. So that is one, the I in inclusivity. And then equity. Are you actually are you looking at, do you have different groups that are participating in this program? Are you ensuring that you're taking into account the needs and circumstances and that you are addressing disparities that may be present and inherent in those communities in a way that is equitable? So that is, your SMARTY goals and objectives, and we can help you as you continue and as you participate in this public health Community Institute. We are happy to help work with you on developing those SMARTY goals and objectives. And here are some examples of what we were talking about, so you could say by December, use cancer late-stage diagnosis and mortality data to identify and prioritize populations most needing cancer screenings. So this is it's specific. You're having what you're trying to use data to identify and prioritize populations. So you have a specific outcome that you're trying to get at. And you can see that again here, you're inserting a date and a jurisdiction. So you're making it specific. Here's your measurable, the number of community members, what priority population, etc. The other thing that we often talk about in the planning process is, what is your logic model or theory of change for your program? That is, what are you doing and how do you know that it's going to lead to where you want to go? And often there's two ways of describing that. One is a logic model, and that often is a very linear description of how your program might work. You're going to say, I have these resources, I'm going to do these activities, which are going to lead to these things happening. So I'm going to have 5 meetings, they're going to have X number of people attend, and because they do that, this is going to happen. So kind of linear, probably not exactly how things work often in real life, but it is one easy way to describe how your program might be working or how you think it's going to work. The other possibility is a theory of change, and that in that way, it shows it's probably a more realistic depiction of how your program is working, because it tries to show all the different pathways that may lead to change. So even if they're not connected to your activities or resources. And so what happens is you have some activities and strategies. There's some mechanisms that happen. They result in some things some outputs, some things that you can measure, and then there's some other pieces some other forces at play that lead to your outcomes that you're looking for. And so here's a way in which it's a visual depiction of your logic model versus your theory of change. And so in the logical framework or the logic model, you have your activities that lead to some outputs that lead to outcomes and your broader goal or impact. Whereas in the theory of change, this may be your activities, but then there's other things happening that are not necessarily within your program, but are also contributing to the change, to the ultimate change that you want to see and some of the outcomes that you want to see. So that's step 2. And after step 2, you should have a good idea of, what your evaluation is going to look like, what data you're going to be collecting, what are you trying to measure. And so then step 3 is to actually start executing. You're executing your program, and at the same time, you're executing your evaluation plan. So you're making sure that you are collecting the data, you're making sure that you're monitoring that data collection, and you are starting to do some preliminary analysis and thinking, and discussing what you see. So what are you going to do in executing? You're going to either have developed or selected your data collection instruments and you are implementing those. You are either, and so if you are implementing your own data collection, you're collecting primary data, or perhaps you're also looking at other records like medical records or census data or vital statistics records to augment the information that you're looking at. And then in addition to that, you're going to be monitoring that data collection and some of the results. So you'll want to make sure that the data you're getting is what you expected, that people are doing it correctly so that it's being implemented in the way that you envisioned, and have that conversation. And if there's an unexpected result that you're seeing, perhaps you will need to reevaluate. And so an evaluation plan, the other piece is, even though we are talking about these steps as something that you go through, it's possible that you are in step 3 and you need to go back to step 2, to the planning, because something that happened was unexpected, and that changes. You need to change your planning, and then that you need to change your executing. So an evaluation plan and evaluation is a living exercise, and it's not static. It doesn't, once it's in place, it doesn't necessarily have to stay that way. It can change. So, but let's say that we've executed, we've now collected, we have maybe 6 months of data that we've collected, or we have a years of data that we've collected. And so at this time, we're ready to analyze more in depth and to review and summarize so that we can then share it with people. And in that step, you may also look at other sources of information that will support what you are finding. So, some academic literature, community assessments, engaging with stakeholders and providing them the data and getting feedback from them. So you have your results and you can say, does this look right? Especially if you have a lot of qualitative data where you have themes. Do these themes align with what the stakeholders expected to see? And that helps you with creating your final reports and your deliverables. So, what you have left once you're done with your analysis, you have your data that's analyzed, you have some draft deliverables, and then maybe through that engagement with stakeholders or adding the additional academic research or other pieces, you finalize your deliverables, and then you're ready to start thinking, or you're ready to disseminate. As we said, you need to be thinking about disseminating ahead of time, because you need to be thinking about who are your audiences for that dissemination. And so your step 5 is to really put that information out to the different stakeholders. Maybe you're communicating to your funder, you're communicating to the community that the program is taking place in, you're communicating to the program participants because it's data about them. So it should be for them as well to share, this is what we're seeing that is happening with the program. Does that is that congruent with your experience in the program? So always important to make sure that you are sharing broadly and disseminating the information broadly. So, discussing the findings and how you're going to use it, disseminating, and then saying what is going to happen. What are we doing with as a result of having this information? And that's where we look at how are we going to use it, what have we learned, and how do we adapt what we've been doing based on what we found. Maybe there aren't changes. Maybe your program is working perfectly exactly as you expected, and therefore you're not going to make any changes. But sometimes, based on what you've learned, you might make changes to both the evaluation or to the program implementation. So part of the using, learning, and adapting is to reflect on the process of the evaluation and the process of program implementation, to develop some recommendations if it makes sense, to implement some of those recommendations, to celebrate the fact that you've done this evaluation, you've gotten some data, you've gotten some information, you've made some recommendations and maybe implemented those, and then go back to your framework to step one and start all over again, because chances are that there might be some things that need to happen. And so that is the framework, and that is this is our last slide. We have our contact information here, as well as some references for you. And we hope that this has been helpful and interesting, and we look forward to working with you through the Public Health Community Institute. Thank you for listening, and hope you enjoy it.